Hi, everybody. I'm Wendy McCallum. This is my first fake podcast, and I'm really excited to have my first official guest today, Dr. Sarah Baillie, who is a naturopathic doctor at Halifax Naturopathic in Halifax, Nova Scotia. And I really wanted to have Dr. Baillie on today because, full disclosure, I am 49, turned 49 actually 2 days ago, and I am in the throes of peri-menopause, possibly full menopause, yet to be determined. And I went to see Dr. Baillie a couple weeks ago, and we had such a wonderful conversation. And it was just, there was so much insight in the conversation, and I just found her to be so nurturing. And I've known Dr. Baillie for quite a while. And I just thought, while I was in there, this would be a great thing to share with everybody else, because not everybody has this information. And I know that because I get questions about menopause all the time in the course of my practice as a burnout and balance coach. So I'm excited to have Dr. Baillie here. Dr. Baillie has a special interest around the effects of stress on us as humans, but she's here today specifically because of her great wealth of knowledge around women's issues, in particular hormonal issues around perimenopause and menopause. Welcome, Dr. Baillie.
Thank you.
I don't know if you know this, but I call you the Meno Whisperer behind your back.
Oh, do you?
I do, because you just have this incredible way of talking about these issues, and it's so relatable. And I love that about you. And I'm really excited about you being able to share that with everybody, whoever listens to my fake podcast today. So the first question I have for you is just in terms of getting to where you are now. Did you always know this was what you wanted to do and what you wanted to specialize in? Like, how did you get to this place where you are now, where you're just really an expert in these issues?
No, I graduated from naturopathic school in '98 and opened a practice and started out seeing people here in Halifax. And then there was a big health study that was halted. I think it was 2002, 2001, 2002. Can't remember exactly. And it was the study of hormone replacement therapy. Well, it was a study of women's health, but the arm of it that was halted was around hormone replacement therapy and cancer effects and osteoporosis, heart disease, all the things that they're measuring. And that was halted because of concerns of increased risk of cancer. And my phone started ringing because all sorts of people, all sorts of women on hormone replacement therapy wanted to come off immediately. And so very quickly, a couple of years into practice, even though I figured women's health would be an area that I specialized, but very quickly I had to become an expert in hormonal health. And I was 30 at the time. So I had no experience myself with menopausal symptoms or perimenopause. My mother had a hysterectomy. I never knew anything about her experience really. And so I was just flying by the seat of my pants. Right?
Yeah.
Now I'm 51 and am right in the middle of it myself. So it's been kind of a journey of watching and being with women as I've learned so much and they've learned so much, and we've all kind of done it together, and here we are.
Yeah, that's amazing. We were chatting before we officially started the fake podcast, and I was asking you how many women you think you've seen over the years in relation to these issues, and you said probably thousands over the course of the last 22 years. Yeah.
Yeah, there's been probably 80% of my practice is women, and I've definitely been more and more since my kids were born, and I decided to sort of narrow the practice a little bit. It's been more and more around hormonal health. I still see people for other things, but this is mostly what I do. And it's the thing that I really get the most charge out of, if you will, because the women at this period in their lives for me are often don't have nearly enough information and are so engaged once they get it. That's what's exciting about it.
Yeah, that's exactly why I wanted to have you on, because I'm in a similar boat. My mom had a hysterectomy. I had zero information about menopause. I did do a program with another naturopath who, Dr. Jen Sleep-Huber years ago. And that's really where I learned just the base knowledge that I have around this. But I've been gathering it myself, and in working with like the hundreds of women that I work with, it's just such a common area of confusion. So I have some questions of my own, and then I gathered some questions from some of my followers who wanted me to ask you some specific things. So if you're okay, I'll start going through some of those. The first thing that I would love for you to do is kind of walk us through what the journey is hormonally for women from kind of adolescence, which is where I've got a 16-year-old daughter, so she's like right at the beginning of it. So adolescence through to maybe post-menopause, like in terms of what that looks like with our hormones and how they shift.
Well, in the teenager, adolescent years, just post-menarche, we call it, which is the beginning of menses, or after your first period. Periods can be quite irregular. Hormone balance is quite irregular. Sometimes young women ovulate, sometimes they don't. For the first few years, I think anybody who has a teenager or who was a teenager will remember that that's not always consistent. And then there's sort of a peak fertility. Now, as I say this, of course, I'm talking about the average. Everybody's different. There are women who struggle with fertility. There are women who have a completely different experience. But for the most part, then there's a sort of 15, I guess, year period where there's let's say 20 to 35, where there's very in a normal, regular, healthy cycle, then there's regular hormone fluctuations every month and periods. And that's sort of what we would call, from a purely biological standpoint, like the peak of fertility, I guess. And at about 35, things start to change a little bit. And that isn't necessarily as noticeable for many women, and it's not noticeable on blood tests. This is the really important piece here, is that at 35, if you said, I think my periods are changing, your blood work, if we measured the estrogen and progesterone and the FSH and the LH, which are the 4 hormones that we're measuring to check cycles, those would not necessarily reflect a state of entering perimenopause. Right? And so from 35 to 40, I wouldn't necessarily say that's perimenopause, although I do have patients who seem to have started around 38, 37, but often their mothers had early menopause. So the whole thing is sort of shifted backwards. Where women really might start to enter the world or the years where their hormones are shifting, I usually call it at about 40. Anything earlier than 40 is considered premature. And we start to worry about bone density and other factors. But around 40, when we start to see changes in hormone levels, you're still not going to see this on blood work, not necessarily, especially if you're not having changes in your cycles. But you may start to see early symptoms of perimenopause that you don't attribute to perimenopause. So this is the really interesting period that can be up to a decade long before you actually go into menopause, which is defined by 12 months without a period. And if you were to check blood work at that period, then there would be 2 of your hormones would be elevated. That would be the FSH and the LH. So when your family physician does your blood work and you say, please check me for menopause, they're checking your FSH and your LH. Those are the hormones from the pituitary that tell the ovaries to make estrogen and progesterone. And when the estrogen and progesterone are very low postmenopausally, then these hormones from your pituitary gland go up, because they're the signals that are trying to get your body to keep making hormones. So the period of time that's the most variable, well, there's 2 periods of time that are most variable, interestingly, which is kind of adolescence, which is a very rocky time, and then perimenopause, which is also probably the rockiest time of those two hormonal, those 4 hormonal times.
Yeah, and when I was into your office, we don't have it today. If I could find it, maybe I'll try to share it with this podcast. However, like fake podcast, you showed me an image of like kind of normal fluctuations of hormones during kind of those early years up until maybe 30, 35, whatever. And then showed me the perimenopause one where it's just literally all over the map, like makes no sense. And then you get into menopause and it starts to decline. And
calm down again.
yeah. Yeah. And that was really fascinating to me. I have clients on the regular who will say to me, I am not in perimenopause. Even friends of mine, they'll say, I'm not in perimenopause. And, you know, my friends are all in my age bracket. So they're all in kind of mid to late 40s. What are the chances that you're not in perimenopause in your mid to late 40s?
Well, I do have patients who I can say, you really, you know, you don't seem to be, from a symptom or hormonal picture, in perimenopause, but I don't have many because they're not seeking help. So
right.
Whether, you know, those women are sleeping, they're not hot, they're not irritable, they're feel their weight's under control, they still have a sex drive, they don't have restless legs, they basically have it all.
Yeah,
you know,
exactly. They don't need you.
They're not coming to me. I don't really see these women, but I mean, it's technically defined as sort of 5 to 7, and I guess you could go up to 10 years before menopause. And some women sail right through it. I don't see those women really.
Right.
So I would say that they're the lucky ones. What the age group that I'm interested in the whole process, but I will often say to my patients that, you know, I end up with a huge influx of women at around 45, 46, 47 on sleeping pills and antidepressants who tell me that they're not necessarily in perimenopause. And my argument would be, if you were sleeping and your mood was stable, then like those symptoms are the symptoms of perimenopause, basically. They just started for you when you were 40 and nobody said your hormones are starting to shift and that's what you need to deal with. Obviously, that's not everybody, but in a lot of cases, by mid-40s, nobody's calling it perimenopause, but the symptoms started 5 years ago. And when I talk to women about, you know, how long have you not been sleeping? Well, the last year or so. I said, no, really think back. How long have you not been sleeping? And that means a light sleep, or it means waking up a little bit earlier than before, like not intentionally. It means getting up a couple of more times to pee. Those are the sorts of things that women who are just kind of on the go, they've got businesses and kids and jobs and families to run and whatever, they just get on with it until it gets to the point where they can't handle it anymore, and then they end up on a sleeping pill, right? And they also end up exhausted and anxious and depressed. And so that could have been solved 5 years earlier, as far as I'm concerned, in a lot of cases.
Sure. So in that regard, maybe we could talk about, because I suspect that a lot of people who watch this podcast or listen to it are not going to have been to see a naturopath before. So they're people who are not familiar with naturopathic medicine and the difference between naturopathic approach maybe to some of these issues and kind of a typical, you know, obviously varies from doctor to doctor, but a typical conventional medical approach. Can you kind of talk about that?
Yeah, so I think the reason why there's so much confusion around perimenopause is because in conventional medicine, they haven't locked it down. So it's like there isn't sort of a definitive time period, there isn't a definitive diagnosis, and there isn't a treatment. So the treatment ends up being birth control pills or antidepressants or sleeping meds. And so it doesn't actually have a life of its own, really. It's like the symptoms of it are treated. The heavy bleeding from fibroids could be treated. The sleep and the anxiety could be treated, but nobody's attributing it to the central cause. And so as a naturopathic doctor, my job, I'm like a hormone detective. So I'm just kind of looking for where we can help to regulate the system, help offload some of the stress of the system to try and let the body do the work of going through this hormone transition itself. How can we support it? What do we need to do to get women to sleep and to feel calmer? And so all of those things are related to hormones in your 40s and 50s. And so I basically chase women's hormones around. Like we try one thing, you know, we look at what seems like the obvious to me. And if that works for a while, great. And as the hormones shift again, then we tweak it and we sort of like just ride the path with it. And instead of using, there's always a place where some women need conventional medications. I'm not against that. I just want to make sure that they're exploring the hormonal connection as well, because there's a chance that they may be able to reduce dosages or get off that medication. It may not be necessary.
Yeah.
So I'm looking at trying to, as you called me, the hormone whisperer. Is that what you call me?
Meno Whisperer, same thing.
But, yeah. So, or the Meno Whisperer, yeah. So I'm trying to like whisper to your body. That sounds really hokey. That's not what I mean. I mean like give your body the resources that it needs to do this, to make this transition itself as much as we can. That's what my job is.
Yeah, I love that. So if there's somebody out there who's listening and they've been to see their doctor about this and they feel like maybe there's more that they could be doing and they're interested in exploring a different approach to it, then naturopathic medicine can be complementary to that, or it can, you know, it's I would say that
I'm losing you a little bit.
Are you? Can you hear me now?
Yeah.
You hear me now? Okay. I was just saying that naturopathic medicine can be complementary to conventional medicine in many cases as well. It's not necessarily one or the other.
It doesn't have to be one or the other. This is, that's one of the big misinformations out there, is that, you know, I've always seen my job as working with conventional medicine to help best support a person. Whatever needs to happen, that's what we need to do.
Right. Yeah. Yeah. So one of the things I really wanted to talk about with you, because you raised this the last time I saw you, and I was totally fascinated by it because it resonated with me when I started thinking about my own kind of path through all of this. And I would say I'm one of those women who, maybe it's luck, maybe it's lifestyle, I don't know, but I kind of made my way through peri-menopause relatively unscathed. The only thing that I had during the course of peri-menopause that was like an obvious symptom of hormones to me was had a period where I would have night sweats a few nights before my period, like for a couple of years, like maybe 3 days before my period started, I would have night sweats. And when I stopped drinking alcohol, which a lot of the people who are watching this podcast know that I stopped drinking alcohol about 2.5 years ago. When I stopped drinking red wine, that disappeared for me. But besides that, there wasn't a lot happening for me during that period. So when we had this conversation, I started reflecting back on some of the things that I had experienced, and a lot of stuff started to make more sense to me. And I think that's going to happen for other people when they listen to this podcast. But we were talking about kind of the biological timeline for women in terms of, you know, how our bodies are designed, and how our hormones play into that in terms of child rearing years, the most fertile years. And then you were talking about how that does not jive with what most women are doing. So me, for example, didn't have my kids till I was 32. Lots of women have their kids far later than that, just because we're just doing more as women. And we were talking about how challenging it can be for women who prolong their family, like prolong the time when they start their families, and then kind of are at the same time moving into perimenopause. And I've never really thought about that before, but maybe you can talk a little bit about that if you know what I'm talking about, because that was a very rambly question.
No, that's good. That's my that's the most fascinating demographic to me. And if I had a researcher on my team, I would have them researching the 40-year-old mother with young kids at home, to see how different that is than the 40-year-old mother from 30 years ago. But so I'll explain why. So if you think about our biology, and now lots of people choose not to have children. by choice and also not by choice. So I'm just going to use our biological system as a descriptive, as a way to describe it, because the way our biology works. This has nothing to do with people's choice. Okay.
Right.
Just to clear that. So if you think about our biology and the reproductive cycle, and estrogen and progesterone are sort of your two main hormones in those fertile years, and those what's creating periods and ovulation and all that. Those hormones also help you nurture. So they basically they allow women to put aside other things in their lives in order to prioritize nurturing and caregiving. I mean, it's kind of basically so that we don't eat our babies.
Yeah, you know? I love, you said that, you said estrogen is the hormone that keeps us from eating our babies, and I loved that. Yeah.
So you have to, like, otherwise parenting would be outrageously, I mean, it's already outrageously stressful, but if you didn't have those hormones, you just walk away. Really? Right. So those hormones are the hormones of nurturing, and we see it in animal studies where if you take the hormones of nurturance away, then the animals will abandon their young. That's basically what happens. So if you look at women in their fertile years, you will often find a lot of nurturing going on. So it doesn't matter whether you actually have physical children to nurture, or you could be nurturing plants, you could be nurturing your job, you could be nurturing your volunteer commitments, you could be looking after parents, or you could be in a relationship where you're very much the nurturer, there's a lot of energy that goes external, that is looking after everyone else.
Right.
Again, this doesn't happen with everybody, but a huge percentage of women, all of the women that come to my office almost describe this. And while the hormones are there, this is allowing you to continue to do this. And so therefore then there's a whole system that gets set up of expectation of you to behave a certain way, right? So then about mid-40s, for some women early 40s, but mid-40s, the hormones start to do this. They start to drop and fluctuate all over the place. That energy of nurturing starts to decrease. And when that starts to decrease, then this system that you've built out here that still expects you to behave a certain way feels really overwhelming. And it's very hard for women, probably from a sociological perspective, with guilt and expectation and duty and all the things that are kind of driven into most women, or a lot of women. So you take that in combination with the fact that women don't know that this hormonal shift is happening. And you have a system that is still demanding of you a certain kind of behavior, certain kind of love and nurturing and care. And internally, women are starting to feel like they don't want to do it anymore. Because the veil of estrogen has kind of lifted, and all of a sudden they're seeing this for what it is, which is everybody's taking all of my time and my energy, and I have nothing for myself. And if you don't know why that's happening, it creates resentment and anxiety and depression and anger and rage and divorce and all, I mean, the list goes on. The number of women I've had to come into my office and say the equivalent of, if he doesn't pick up his underwear, I'm going to divorce him, right? And they're serious, right? But the reality is that, if underwear is figurative, they've been picking up his underwear for 20 years now, and all of a sudden they don't want to do it anymore. Yeah. So it's a real communication problem if a woman has no idea that now her body is saying, it's time for you. Time to look after you. And we have an extra layer of stress in there with women having babies later. So biologically, we're supposed to be having babies at 12, 13, 14. Not practically. I look at my 12-year-old thinking no. But biologically, by the time you get to 40, like your baby should be leaving, right? That should be, if you look at peak fertility, that's by 40, your baby should be leaving. And so the women, my kids are 10 and 12, and I'm 51. I had them at 39 and 40, basically, or 38 and 40. And now I'm full on in perimenopause. And I couldn't tell you whether I have any nurturing hormones. I just have to do what I do. But I'll bet that if I'd had kids when I was 20, I would feel differently about doing what I have to do.
Right.
In terms of nurturing, you know?
Yeah.
And one patient of mine had a really good example. She said she had a child from an earlier marriage who was in her 20s and a child who was 11. And she said she was there at every single recital and on the PTA and doing everything, baking things for bake sales and like fully engaged for the 22-year-old. And by the time the 11-year-old was doing all of this, she was done.
Yeah.
She had to force herself to go to every gymnastics like performance or whatever. And
yeah,
it sounds horrible, but it's representative of the fact that those nurturing hormones aren't there anymore. And it's actually not your fault. It's just the fact that your body's done with this external use of energy. And it really, if you look at it from a chakra perspective, I don't know if any of your clients are kind of in touch with that, but the second chakra, which is the chakra with ovaries and the uterus, that's the area of creativity, of creation, right? That's where you create a baby from. And so if your creative energy is going out for 30 years or 20 years, and then all of a sudden around perimenopause, it turns inwards and starts to become the creative energy of creating you, and you're like recreating you, if you will, in that third phase of life, then you can understand why it's important to start saying no, to start not doing things, to start listening to that. Glennon Doyle calls it the knowing, like listen to that knowing, and you will actually find that you may not want to volunteer for that particular committee. Let the 30-year-olds do it. They're the ones with all that nurturing energy, right?
Yes, so, I'm gonna like hashtag let the 30-year-olds do it. That's my new hashtag. Yeah. I love this.
Totally.
It's such a relief for me, and I'm sure it will be for other people to hear this, because it takes that, because you really, if you don't understand this is happening, and I had no idea this is happening, which is why when you were talking about this, I had this just light bulb moment where everything made sense for me at the age of 49. You know, I have teenagers now, and I'm just naturally less concerned. I love them, but I'm just less concerned. And I feel like I can almost point to the year when that switch flipped for me. And I just was it's not an engagement issue. It's just, and the whole like turning of the creativity and that creative energy inward is also amazing. I think I have so many women that I work with in this age demographic who are struggling. They feel like something is missing and they don't know what it is. And through coaching, we explore a lot of different things. And it's so often the case that they used to have this kind of outlet for creativity before they had kids. And, and now they find, now they got pulled into this busyness and, just trying to kill it at their career and be the best mom and be the best partner and all that stuff. And now they're at a place where those people don't need them as much anymore. And their estrogen's probably dropping. So they're not feeling as nurturing. And the thing that's really missing for them is some form of internal creativity. And so when you said that to me, that really, I mean, this fake podcast is brought to you by peri-menopause.
Yeah, totally.
Right?
And my mother started, like, she took up, this for me is a classic picture. So she forced all of us to take stringed instruments when we were young, like Suzuki violin, the whole thing. Everybody in my family except my brother hates it because we were forced to do it because we were living her dream, right? And when she went like fully through menopause, she started playing the cello. We were like, you should have just played the cello back when we were kids. Like, that was about you. It wasn't about us. And so that was her creativity. She finally had the space, and the hormones had dropped, and she had the space. And she was like, oh, it's actually me who wants to play the stringed instrument, right?
Yeah.
And so that for me was just so indicative of the fact that creativity energy, that creative energy comes back to you. But if you don't nurture it, then you feel at odds and you feel resentful and and there can be anger there, and there can be like, this time is about redefining yourself. And it's not just that kind of empty nest feeling, or, you know, I've reached the top of my career, or whatever it is. It's about redefining you hormonally too, and creatively and energetically. And, you know, it's rocky. There's no question. If we bring up that slide, you'll see how difficult it can be. But really, you have to go through it in order to have the smooth sailing on the other side. And the number of women in my practice who report that after that perimenopausal chaos, it's a feeling of calm. It's, you know, if they engage it, that's the thing, is if you don't engage it, you end up with anxiety and anger and resentment. But if you engage it and really have the chance to look at it and try and start, I mean, for some of my patients, I had a woman the other day say that I had changed her life by telling her that she didn't have to bring a salad to a potluck. Right? That there, you know, she was always thought that she was expected to bring the thing to the potluck. I said, you don't even have to go to the potluck. I said, but if you're going to go and you don't want to bring a salad, don't bring anything. And she came back and said that she didn't bring anything. She was very proud of herself. She felt really empowered by that. Like, I actually don't need, and she said, nobody noticed. I was like, there you go. Yeah. Right? Like, just
it's true.
Don't bring the salad to the potluck. It can be that small. Those are the little wins, right? This doesn't have to be life-changing stuff, you know, where you leave a partner or quit your job. It can just simply be listening to that knowing and thinking, okay, well, you know, it's important that I do this thing for my daughter. That's important. It is not important that I take a potluck to a salad, or a salad to a potluck, right? Yeah. And that can feel like a win because it gives you that extra energy and that extra space.
Yeah. Yeah, 100%. I think that's going to resonate with a lot of people who are going to listen to this, because so many of the people that I work with, the women that I work with, have that thing going on where they've just been go, 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 go for the last, like, whatever, 15, 20 years. And they're at a point where they just want permission to stop.
Just stop.
It's just, you know, and a big piece of my coaching practice, and I talk about this all the time at corporate wellness stuff, is this idea of like how to say no. Like, I actually teach people how to say no more often, because we just feel, I think it's partly you know, I'm going to generalize here, but I think women in particular are raised to feel like we need to be polite and we need to be helpers. And so it feels wrong to us to say no to things, and to we just, you know, have a bad habit of saying yes to far too much stuff. So I love that. And I definitely, when I think back, you know, when I look back at my 40s, can see that there was a period in time where that shifted for me, where it shifted and I started getting more confident in my ability to say no to things and to actually start taking what I needed instead of just giving to everybody else what they needed. So thanks for explaining that. I just really love that. I think it's such an incredible explanation of what is happening with us emotionally, as well as we go through this.
The other piece of that, so there's some analogies that you can use, but so is that the creativity going inward is also, like, the therapist that I've had for years described it to me as like the closing of the oyster shell for a few years. So it's like the oyster shell closes and then a pearl is made, right? Oh. So it's like you have to go inward. You have to stop, and you have to just be in yourself for a bit. And that can be hard, because a lot of the things that, even if you've been actively looking out for your mental health and actively like seeking to heal traumas of the past, etc., you will have, if you've stopped to nurture for 10 to 15 years, then you will have gotten only a certain distance in that healing. And then the estrogen takes over and everybody else becomes important. And then in perimenopause, that stuff comes up again. It's for the next layer of healing, right? For the next layer of investigation. The things you thought I thought I was over with that. Lots of people will say that. I'm like, well, you're probably not. You just, you know, it was on hold for a while. You got to a certain level that you could handle. And then now it usually needs to be revisited. And so that's where some of the rockiness comes from. It's also where the importance of that stillness and of going inside comes. Because really, if you look at communities that are not Western communities that don't respect the role of older women. There are some Asian communities where the menopausal woman sort of becomes the matriarch, and all the younger women in the family, including the daughters-in-law and whatever, look up to her. She doesn't have to do anything, so there was one study I read in particular where there really wasn't a word for menopause so much in this particular culture, because it was just a natural transition to the crone, right? To the wise woman, that it wasn't considered a thing that we had to fix.
Yeah.
Right? It's just a natural transition. But in order to get to that place, you have to know who you are. If you're going to be the wise woman in the community, then you have to have gone to that place where you can unravel some of that stuff that needs to be unraveled.
Yeah, I love that. Just to switch kind of topics a bit. One of the other things that we talked about that was really fascinating to me was, we were talking about, I think I told you that during our session, I stopped drinking alcohol, and you said, good for you. That's good. That'll help with, because my main concern that I came to see you with, which I don't mind sharing here, is that I was having, in the month of July, I just got hit with this like onslaught of hot flashes at night, like these night sweats that were just keeping me up. I was waking up like 8-9 times a night, which thank goodness I came to see you, because it seems to be under control now. But we were talking about the triggers for those things, which I assume are the same as, so the night sweats are really just hot flashes at night. Am I right? Mm-hmm. Yeah. So the triggers for the night sweats and hot flashes would be similar. So I had come to you and I said, look, I think I'm doing all the things right. And then you asked me about caffeine. And I said, Sarah, don't take my coffee away, because it's my one last pleasure. And you explained to me in a really convincing and compelling way why it might be a good idea for me to think about cutting back on caffeine. And I have, since I went to see you. I've cut back to almost nothing now a day. I'm just drinking really strong tasting decaf. But what you were talking about, this kind of our tolerance, and how as women, our tolerance for some of these kind of stimulants, I guess, these things that are irritants or stimulants to us, are how our window of tolerance gets smaller as we get older. Can you talk about that for a second?
Yeah. So, I mean, it's interesting when you get into the research on hot flashes and night sweats. There's not a whole lot of knowledge about why it happens. I mean, there's lots of theories, and we know it's related to the central nervous system, but there really isn't an adequate answer for why women go from having, let's say this is the window that I use. So let's say pre-menopause, you might have like a window of tolerance for change within your body that's this wide, let's say. So anything that happens within here, you can handle. So if that's like drink a hot drink and your body temperature changes, but you don't have a hot flash, right? That's, or take in alcohol, for example, which is a vasodilator. So that's going to open your blood vessels. It doesn't have you might get a little flushed in the face if you have a particularly responsive system, but you're not necessarily going to break into a full hot or night sweat or hot flash at 29 from having a glass of wine, right? Right. But then for some reason, this hormonal imbalance, the roller coaster ride, makes that window of tolerance about this big. And so anything that is a stimulant, anything that provokes vasodilation, anything that provokes your nervous system at all. So happy thoughts, sad thoughts, stressful thought, anything can trigger that. And so it's just like bing, 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 bing. You have all these potential reactions. Not everybody's going to react to the same things. Red wine is a really bad trigger. It's very sad that women have to give up their red wine at a time in their life when they might want to be having it the most. But red wine is a big histamine releaser. So that's one of the reasons why.
And what's the caffeine? Why is caffeine a trigger?
Well, caffeine triggers, so it's interesting because I remember being, 18 and being able to drink a coffee before bed, literally have no effect on my sleep. And then basically every woman over 40, I have no evidence for this other than my own practice, and all of my friends, of course, because I've taken them all of caffeine, but I would say 99.5% of my patients do over 40 do better off caffeine, because the stimulant effect of caffeine is too much for this window. Right. So it's a central nervous system trigger. It releases cortisol. So it just amps up your stress. And you can sort of be a 3 coffee a day drinker and continue to do that over the bridge, say from 35 to 45, and you can be fine at 35, and 45 you're anxious and not sleeping. And you don't think it's the coffee because you've been drinking this way since you were 35. Yeah. So I hate to say it, but most women are very disappointed when they hear from me. It's like the worst conversation I have to have in my office, basically every single time. It's like, I'm going to have to ask you to switch to decaf. And largely because I don't want to be treating caffeine, right? Like there's no point in me giving you things to do and supplements to take and diet changes and whatever if I actually think that caffeine is a major part of it. So we kind of need to clear this a little bit.
Now, you did say to me, I'm just having a flashback. You did say to me, it's not forever, Wendy. So explain to me what you meant by that. I mean, I might never go back. It's like alcohol. Once you figure out how to make it small and irrelevant, then you probably won't go back. And with caffeine, I don't know if I'll go back to it now that I've gotten to a place where I realize I don't need it like I thought I did. But what did you mean by that when you said that?
Well, so I have had some patients who, once they're through menopause and once they're sleeping and once they're on that other side where things flatten out, as long as they're, they've also looked after the other things in their lives, so their stress levels aren't high and they're getting enough self-care, then they can often handle 1 cup of coffee. Mm-hmm. I don't know that women ever go back to 3 without feeling it. It's a drug. Once you get 7. It out of your system, the minute you have it again, you feel it for sure.
Yeah.
Okay. So
that makes sense.
This is not, I love coffee. I was known for drinking 5 or 6 cups of coffee a day at naturopathic school. So this is not coming from someone who doesn't love coffee. I appreciate all of your pain. I drink decaf.
I know,
really
Sarah.
Good decaf and really strong decaf.
I have been drinking Toothless Shark from Laughing Whale, and I quite like that one. So that one's a good one too, if you haven't tried that one yet. And I know what you're saying, because I feel terrible when I have to help people stop drinking red wine, which used to be my best friend. So I get it. I want to ask you about something that I get asked about a lot. As you know, I have a background in natural nutrition. And so people come and ask me about food stuff, even though I don't coach specifically around food anymore. I incorporate it into a lot of my coaching. And one of the questions I get asked a lot by women in our age bracket is whether they should stay away from soy. Now, I've always been a proponent of organic soy. So I always suggest people get organic or non-GMO, because if it's not organic, it's probably GMO. And so that's just always been my guidance around that. And as a vegetarian, I incorporate lots of phytoestrogen rich foods in my diet. And I have tried to explain to my clients why I think phytoestrogen rich foods can be a helpful addition to their diet, but I would love to hear your take on it.
Yeah, so the soy debate, it was kind of put to bed about, I'm terrible with time. It could have been 10 years ago. It could have been 5 years ago. Big study in the British Medical Journal, I believe. Basically, I understand why everyone was afraid of soy at the beginning when they discovered that it had phytoestrogens in it, because nobody really understood how a phytoestrogen worked in the body.
Right. So
the way I describe it is that phytoestrogens are actually helpful, and we've now seen in breast cancer studies and survivorship studies that soy actually enhances the effect of some of the medications for breast cancer, for example. So the way I describe it is the phytoestrogens are weak estrogens. Estrogen in your body is very strong. It's a growth hormone. It's meant to grow things. And so estrogen, when you have, it's like a locking, let's call the lock and key sort of situation, where you have if this is a receptor on a cell, so any cell in your body, and it's the estrogen receptor, and this is the estrogen, it comes in and it fits, and then it turns on the mechanism of the cell that is estrogen dependent, whatever that may be. It might be growing bones, it might be keeping healthy collagen, all those things. So estrogen does that. And a phytoestrogen comes in and it let's say it's just weaker, so it doesn't have the same impact. So it comes in and it sits in the receptor, and then it sort of turns it on a little bit.
Right.
And it doesn't have quite as intense an effect. Or what it's doing is it's blocking, because it's sitting in this receptor, it's blocking the big strong estrogens from coming in.
Right.
Um,
Which
so,
can be a good thing in some circumstances, right?
Yeah, it could be, it can be a good thing. Yeah. And so if your body can digest phytoestrogens, you know, basically legumes are your biggest source. So nuts or seeds, or sorry, beans and legumes and chickpeas and lentils and soy being a bean. If your body can digest those, then they are very good sources of ways to keep the intense estrogen effect of perimenopause regulated, because it can block some of the effect of some of the stronger estrogens. And just back to what happens so it would be helpful to have this graph at some point if you want to post it with
I'll try to find it. Maybe you can send it to me after the podcast.
I'll send it to you.
Yeah, that'd be great.
So there are times in perimenopause where when I first started practice, we were still under the impression that what happened in perimenopause was that it was just kind of a general like decline in hormones towards menopause. But what we know now is that there's actually periods where there's low estrogen, and then there's periods where there's really high estrogen. And we don't know if that estrogen is trying to get the body to release all of the eggs that are old, kind of like to say like, okay, these are done, or whether it's trying to say have one more baby, or whether we don't know why. But there's these huge fluctuations, and that's part of the symptom problem, is that you can have 6 months of high estrogen and then you can have 6 months of low. And we know we're getting towards menopause itself, like the actual fewer, less estrogen in general, when we start to see symptoms of lower estrogen start to come up, which unfortunately can mimic high estrogen, but that's a whole other thing. But you asked me about the phytoestrogens. So yeah, so phytoestrogens can be good in this period where it's often perimenopause has what we call estrogen dominance as part of its makeup. And so where you have this relatively imbalanced amount of estrogen compared to the amount of progesterone, which is a balancing hormone for estrogen. So if you don't have enough progesterone, then your estrogen is kind of unchecked. And so you can use phytoestrogens to help mitigate that effect of the estrogen. And you can also use vegetables of the brassica family. So the cruciferous vegetables like cauliflower, broccoli, kale, Brussels sprouts, I can't remember, cabbage.
Yeah.
Those have compounds in them that help the body take those high estrogen levels and filter or push them through the detoxification mechanism in the body that is the healthiest. So there's kind of two pathways, and one is less healthy than the other, and so it can help push that through. And those are the cruciferous family really help with that.
Right.
Okay.
So in terms of just generally supportive foods during hormonal fluctuations, we've talked about how it probably wouldn't hurt to cut back on red wine. It probably wouldn't hurt to cut back on caffeine for a lot of women, not everybody, but for a lot of women. We didn't talk about spicy foods, but that kind of falls in the same category, right? Where it might cause does it cause vasodilation, or what's happening there?
Yeah, to be honest, I think capsicum. So spicy foods are often caused by, pepper based. And so capsicum is like what we would call a counter irritant. So it does bring blood flow to an area.
Okay.
So, spicy foods is kind of person dependent. It's not always the thing, just like hot drinks aren't always the thing. Sugar is a huge thing. Okay. Sugar is a massive trigger.
Talk about that. Why is sugar such a big trigger? I mean, that's obviously in my wheelhouse, helping people cut back on sugar, get out of a crazy sugar cycle. So what's the connection there?
Well, again, it's like that overstimulation of the system. You put too much sugar in the body, and then the body goes into overproduction of insulin, and then the whole system goes into what I call like an emergency state, right? I mean, if you're putting complex carbohydrates, like back to the phytoestrogens and whole grains and those sorts of things, you don't have this super spike in blood sugar. But if you're putting a jujube in, or you're putting, dessert or whatever, so any sorts of sugar, then you're going to have this spike of blood sugar, and then the body's having to go into emergency state to react to it, to get it down. And so anything that's going to trigger that emergency state is potentially going to disrupt this very small balance that you have in terms of night sweats and hot flashes.
Yeah, that makes total sense. I mean, even outside of perimenopause, women that I work with who have really out of control random patterns with their blood sugar are having a hard time keeping an even keel in terms of their emotions too, just kind of like staying level and coping. They don't cope as well with that. So that all makes sense. So, and then in terms of kind of foods to include more of, it sounds to me, and I don't want to, I'm just doing this because we're getting close to the end of the hour, but it sounds to me like what you're saying is just kind of, it's not rocket science. It's a focus on real food. It's a focus on good complex carbohydrates, staying away from those high sugar foods. If you're somebody who tolerates beans and legumes well, incorporating more of those in your life, other phytoestrogen containing foods, there are lots of them, flax, for example, and things like that, right? Ground flax, yeah. And then also using or incorporating that brassica family of vegetables in terms of your diet. I have another question for you that I have to ask because someone's going to kill me if I don't ask this. Libido came up like 3 times. So can you talk about the connection between the connection between what's going on with us and the dropping libido? Because, there's a lot of fact versus fiction out there, I think, on this. And this is one that when you explained it to me, it just felt like a relief. Because I think a lot of us as women feel like we're always having to defend that. I personally sometimes feel like I'm having to defend it, but it is truly how I physically feel sometimes. So can you just talk a little bit about what's going on there?
Okay, so libido is very complex, very complicated. My best piece of advice is don't have a good book on the go. Basically.
I know, because you said that to me. You're like, basically all of the stars need to align. Like you need to be, you had slept well the night before, you're in a good mood. And then you listed a whole bunch of things. And then you said, and you don't have a good book on the go, which made me laugh because I think that so many women can relate to that. I mean, I guess what you were saying is it is a real thing and it is extremely common.
Yeah. So if you imagine that most women in their 40s, not most, a lot of women, I hate to generalize. I always feel that when I'm talking sort of generally that there are people who aren't going to relate to this, but of course, so women who are complaining about low libido have to understand that in many cases, the body is not being driven to have sex. It's not being driven to reproduce anymore. The hormone pattern, the hormone stability in that cycle is not there, or it's very erratic. And so before perimenopause, you could kind of get over the idea that, well, I'm a little tired, or I've got some things on my mind, or I'm mad at you for not taking out the garbage. That's so stereotypical. But anyways, I'm mad at you for not whatever, hearing me earlier, whatever it is. You can get over that if you're ovulating, right? Because the body is actually like the drive can override that, right? Mm-hmm. Like if you have women in their mid 40s or their late 40s, and they're coming to it, we didn't even talk about adrenal fatigue really, but they're coming to it sort of burnt out, coming to midlife burnt out, tired, sort of rarely getting a lot of time to themselves to fill up that bucket. And if the actual physical drive is not there, then you have to be able to connect with your partner. You have to really like them, whoever they are. You have to like them. You can't have a big stressor going on. The kids have to be away or in bed, or at least, has to be safe. And there's just so many things that the ducks have to be in a row that the hormones aren't really there in the same capacity to override it and kind of say, oh, well, whatever. We're just gonna go for it, right? And so And I think a lot of women feel really confused and guilty about it because they want it back, but at the same time they want rest. So they're, there's just, they want it back because they want to connect with their partners, and they also don't want the argument, right? So it's hard to explain to someone whose hormones have not changed that much yet.
Right.
So men's testosterone levels decrease. Now, I mean, if you're in a relationship not with a man, then that's a whole other picture, because then you've got two sets of hormones happening, right?
Sure.
But if we're talking about a relationship with a man, then we're talking about his hormone levels aren't really changing that much. Not that they'll change, but not drastically in the same way that ours will. So,
right.
And then, in relationships where it's two women, for example, you have two sets of, depending on ages, you have two sets of peri-menopause going on. That's a whole, everybody's ducks need to be lined up, right?
Yeah.
So it's very complex. I have a hard time speaking about libido because it's such an individual thing. And just like we talked about before, when that creative energy turns inward, often women are not really interested in sort of being out there in the world, whether that be sexually or on the PTA or whatever it is, And so it's got many, many layers.
I actually just think it's important that people know it has many layers. I just think it's important to have the conversation and for people to know, like, you're probably not alone in this. You're not alone in this, for sure. It's not like there's a one size fits all answer to this, but at the same time, I think it is really comforting to know that this is a really common thing that women experience. And I'm wondering, like, I love that analogy of the oyster shell shutting and then opening again with the pearl. And I'm wondering, like, what's available to women if you just like go with that instead of fighting that and let it shut and then open back up, and where you might be with all of this stuff, like libido included, probably, if you just give yourself what you need, which of course I'm a huge fan of women giving themselves what they need, which is what we don't do most of the time. I don't know if we talked about weight gain yet. I feel like we talked about it at the beginning when it was just the two of us. Have we talked about it?
Yeah, we didn't talk about that, and we didn't really talk about cortisol and the pregnenolone steal.
Do you have a second to talk about the weight gain? Because I think people are really and the cortisol piece too. So just kind of quickly around the weight gain. I mean, it's a really common thing. I see it all the time in my practice. One of the main stressors that women have is that they are gaining weight during perimenopause, and they feel like it's kind of out of their control. They're really trying so hard to lose the weight, and that's difficult for them. And I've never really had a good that's not true, sex hormone explanation for them. I have always had a decent explanation for them around cortisol if they live really stressful lives. And so maybe these two questions kind of tie together. But what I'm curious about is what the explanation is for that weight gain that happens to a lot of women in the perimenopausal and menopausal years.
Well, again, that's it's very complex, right? So it's partially, every woman needs to have their thyroid checked around perimenopause, because that can change. And so that's worth ruling out to make sure that your thyroid's in good health. We need to look at factors like sleep. So we know that lack of sleep puts on weight, like all by itself. You can change absolutely nothing else. But if you have a decade of not getting a good restorative sleep, you will put on weight. The fluctuating hormones definitely can affect that. Coming to perimenopause, having had higher stress levels. Now, you don't have to have a stressful job to have higher stress levels. You don't have to be burnt out at an executive level to have higher stress levels. Just not sleeping for 10 years can be higher stress levels, right? Because then your body is continually pushing through every single day and ramping up its stress hormones in order to just get you through the day.
It's always important just to clear up for people that you can have physical stress and mental stress, and they cause exactly the same response in your body. So people often forget about the physical stress, and they're like, oh no, I'm not stressed. And I'm like, but wait a second, you've been sleep deprived for 10 years because you had 3 kids in 3 years or whatever, right? Okay.
And another physical stress that's really interesting around perimenopause, which is kind of a catch-22 situation, is that a lot of women, when they start to put on a little bit of weight, start over-exercising. And so over-exercising itself in this desperate attempt to lose the weight, will also shut down the metabolism and increase your cortisol levels. So it's about finding that sweet spot between, I usually suggest that women try and balance out their sort of gym routine or their running routine with an equivalent amount of yoga and meditation and Pilates and things that are quieter on the body and aren't so fight or flightish, right? Yeah. And I often will suggest that women are not so much pushing them. If they come into perimenopause adrenally fatigued and exhausted, and possibly they're what we talked about earlier, what's called the pregnenolone steal, where your progesterone is being sacrificed to make cortisol. So if your body is in a state where you're actually not, you can't balance your reproductive hormones because your body's so busy trying to make cortisol to keep you alive. I mean, we're getting into real fight or flight stuff here, where the body's really just trying to keep you alive. Yeah. So if you are in that state because you're not sleeping, or because you're stressed, or because you're anxious, or because you're hyped up on caffeine, or because you're sweating at night, or all the myriad of other reasons why you might be in that state, then the metabolism is really kind of saying, well, you're really only going to live for the next 30 seconds. So we're not really going to we're not going to help you lose weight, because we need to keep you going. Right?
Yeah.
We're not planning for 30 years. We're planning for 30 seconds. So we're not going to try and keep your metabolism stable. We're actually just going to hold on to everything we can, because this race looks like it's a long one. Right.
Right.
Does that make sense?
So it totally does. It totally makes sense to me. And I've had that pregnenolone, I'm going to say it wrong, pregnenolone steal explained to me before, but now I think it makes more sense to me. What's happening is the balance between estrogen and progesterone is important. And when your progesterone is being taken to manufacture cortisol because you're really stressed, and that's your body's stress hormones, you need to produce more of it in order to just keep you alive, which is what your body's trying to do in stress. What happens is what's the hormone I just said?
Progesterone.
Progesterone. Your progesterone it drops. And so your estrogen balance with progesterone is now affected by that, which just exacerbates the symptoms of perimenopause.
Totally.
Yeah.
Yeah.
So that makes perfect sense.
Cycle.
Yeah. Yeah. Okay.
You're in a really vicious cycle.
So in terms of the weight gain thing, which I know is, again, it's something I try to get women away from focusing on, but at the same time, it's a real concern for women, and I get that. And so around the weight gain would a big piece of the kind of approach that you would recommend for women to really focus on trying to do things that calm them down and just take the pressure off them and actually help to reduce the cortisol. And that's what you're talking about with meditation and with yoga and things like that, as opposed to doing what we all do, which is like freaking out and getting the latest 21-day fix and just going bananas with some kind of crazy diet and exercise routine.
Yeah.
Yeah.
So like more exercise, less food does not always work for the perimenopausal woman. Yeah. It's actually can be quite counterproductive.
Yeah.
More calorie dense foods. So plants, lots more plants, less refined foods, sugars, those sorts of things. Of course, those are obvious, but it's when people really start to, it's such a vicious cycle, the anxiety around the weight loss, that when women start to ramp it up, it's often completely shutting down the metabolism. And the other piece of that is, oh my gosh, I've completely forgot. This is a perimenopausal moment.
That's okay. That's okay. That's what this whole fake podcast is brought to you by.
You know what my best perimenopausal moment was? I actually came to work without a skirt on one day. And that's what I knew. I was like, I am in perimenopause. I'm standing here in my tights and a shirt. This is it. I'm just going to stay. I stayed dressed like that all day because I was like, I just want everybody to know that I am one of you.
Oh my gosh, that's awesome.
But I did want to tell you something about the progesterone. What we talked about earlier about the little Buddha belly.
Yeah, the Buddha belly, right. Somebody who asked me a question to ask you called it the Meno pot, and I'd never heard that for the pot belly of menopause. Yeah.
Right. Yeah. So there is some conversation about the fact that let's say within a 10-pound range, I kind of expect my perimenopausal women to put on 10 pounds. And once they kind of get over it, then eventually they tend to lose it on the other side, or just become okay with it. But the 10 pounds, or that little Buddha belly, which is caused kind of by cortisol, right. In some cases, there's some conversation around the fact that that may be the body actually trying to store a little bit of fat to help you go through the transition of menopause, because fat produces estrogen. Right. And so if you have a little bit of extra padding, then what that can do is it can actually help you from going like into menopause to just like a gentler slide.
Right. That makes total sense.
And that actually, if we allow the body to just do what it needs to do instead of fighting it, that there may be this period where women put on a little bit of, look at where it is. It's right over that second chakra. It's right over that, right over the reproductive organs for most women, right? And it's just like, just allow the body to do what it needs to do. And if we can look at the long game instead of whether I need to buy a new pair of pants next week, if we can actually think of the long game, if we just left it alone, it may actually just resolve itself.
Yeah.
I don't know.
Yeah. No,
I find that a really interesting piece of the puzzle, because the amount of anxiety that I've seen around this 10-pound weight gain or so in perimenopausal women, I think it's that a lot of the women, like 5 or 6 years later, have totally just come to accept it and are okay with it. It's that kind of initial, what is happening to my body? But if we accepted that the body was, as long as you hadn't changed anything, you hadn't started eating ice cream sandwiches for breakfast, right. That's what my kids want to do. As long as you hadn't changed anything, then maybe the body is doing what it needs to do in order to actually support you through this time, so that it actually, you can keep your hormones more balanced without the help of external.
Right. Yeah, I love that. I think if we could just get better at actually getting really real about what it is that we need more of and what we need less of, and just taking care of ourselves and just freaking letting ourselves off the hook a little bit around some of this stuff. Because in my experience, in my past life, I did a lot of work around supporting women with healthy weight loss, and I got out of that for a good reason. And it's because I cannot compete with the conventional weight loss system. I cannot compete with this system that sets people up as lifelong customers with this crazy, this crazy cycle that women go through, which leads to everybody yo-yoing up. Like nobody yo-yos down, and it's just so destructive. And I love that explanation for that. Like, if this is just what our body is doing to try to get us through this period, and it makes sense to me as, those fat cells being like little hormone factories, like the bigger they are, the more we might be able to do that and actually keep that balance going as we go through that. I love that explanation. I have one quick thing. Somebody said that their Facebook feed, and I have seen this too, Facebook is literally listening to everything I say, but God knows what'll happen after this fake podcast. there'll be an onslaught, but that there are all of these ads popping up in their Facebook feed around hormone, like balancing remedies for perimenopause and menopause, and just people trying to sell these products. And I just wonder what you have to say about that.
Well, the internet is a dangerous place to be ordering your supplements from, because so all supplements sold in Canada have what's called an NPH number. It's like the drug company's DIN number, which is a drug identification number. This is a natural health product number. That means that it's been cleared as, like, what's in the capsule is what's on the label, right? So they have checked. They've checked the company, and it's met some rigorous standards. And so anything you buy off the internet, unless it's a brand that you would buy here and you just happen to buy it from well.ca or whatever, all the companies that sell these things, then what am I trying to say?
You need to be I'm guessing you need to be careful, because you have,
But also is, you don't actually know which of your hormones need to be balanced.
Right.
The idea of balancing, it's like when I talk about balancing hormones, I'm just really about trying to get the body to do the work itself. Usually, sometimes we're a little bit more interventional if we need to be, but and really you need to see somebody who can actually help you figure out what stage of that you're in, because as I say, like I change formulas with people all the time based on where they are. And I start people off at different places based on where they are.
Yeah.
And, so then that just takes a lot of experience to be able
well,
to
that makes
that.
perfect sense. When you look at that graph, which I will include with this podcast, I don't know how a one size fits all capsule that you buy off the internet that may or may not be what it says it is possibly going to be the right thing for you on any given day because of how crazy that thing is. So is there anything else that we haven't talked about that you wanted to talk about today? I know I'm cognizant of the fact that I've taken a few more minutes of your time, so I don't want to.
No, that's okay. I can't think of anything. We've kind of basically every topic that we've talked about is a whole topic in itself.
I know.
And so
I know.
on everything. So
I would love to have you come back and talk about like just really focus on the stress side of things and adrenal fatigue and just talk about that a little bit more too. I think that would be so interesting for people. And we can't cover it all in, an hour, but I really appreciate you taking the time to do this today. And again, I just love the way you talk about this stuff. It's just so relatable. And I know that other people are going to find it really helpful too. So thank you so much for taking the time today.
Great. No problem. Thank you.
Okay. Bye, Dr. Baillie.
Okay.
Thank you.
Bye.
Bye.
Bye.